And now it's Boomer Life.
Lifestyle ideas designed to make your life more engaging, meaningful, and complete.
Celebrating the baby boomer generation. This is Boomer Life
With Sterling Fox.
Well, good morning and welcome to Boomer Life here on AM 650. I have a guest in studio who is quite familiar to many AM 650 listeners. It's a real pleasure to welcome back to our airwaves reconstruction and implant dental expert, Dr. Ron Zokol. Good morning.
Good morning, Sterling. It's great to be back with CL 650.
Well, it's nice to have you back. You used to be on Sunday mornings.
That's right.
Talking about what we're going to talk about for the next hour here on Boomer Life. And it's really good to have you back to talk about. This is a subject that, well, all of us boomers are involved in, like it or not. It's part of the aging process. And it's not something we've talked a lot about on Boomer Life so far, Dr. Zokol. So real pleasure to have you back with us.
Thank you.
Talk to us about being a boomer and having teeth. Is there a degeneration in our mouths as there might be with hair loss or hearing loss? Is aging hard on the teeth?
Oh, yes, in a single word. But let me say this, that it correlates very nicely with age because the bacterial factor in the mouth, as well as the massive forces that we generate between our teeth as we function, be it with food or even as we bring our teeth together without food between them. If you do that day in and day out, there's a consequence, and the severity of how much force you put on will often dictate the degree and rate of breakdown of your teeth. And baby boomers they've been doing this for a lot of decades.
That's right.
There's a youthfulness that comes with having teeth that look really good, and an aging process that happens when teeth don't look so good.
True. And you don't have to be in your 50s to look old with old teeth.
Oh, sure. People with dentures and collapsed dentitions and such, even in their late 30s and 40s, will look 10, 15, sometimes 20 years older.
Mm-hmm. Now, I introduced you as a reconstruction and implant dental expert. But once upon a time ago, Dr. Ron, you were a dentist.
And still am, I must say,
Of course you are. Of course you are. But what have you done since you graduated from dental school and that has created this whole new era of activity for you, the whole matter of reconstruction and implants? When did that start?
Well, I think it started many, many years ago. We have specialties in dentistry, specialties that focus on prosthodontics, periodontics, which is the treatment of tissues around teeth.
What's prosthodontics?
Prosthodontics is the structure, the teeth themselves,
Okay.
a prosthetic replacement of tooth structure or teeth as a whole.
All right.
And you have oral surgery.
Yes.
This is more advanced surgery and not specific to around teeth, but anything in the oral maxillofacial area. That's anything in and around the face and the upper and lower jaws and such, and more advanced head and neck surgery, things like that but what we found, and what I found many years ago, and I had the privilege, my father was a prosthodontist, one of those, he's a certified specialist in prosthodontics. I had the privilege of spending 20 years with him before he retired. Massive opportunity to learn that some things that you can't get at the university level. It's the experience factor.
Mm-hmm, right.
So I started to do advanced reconstructive dentistry very early in my career, and now it's been 40 years since I've graduated. 40, wow.
But what a career you've had. You just haven't stopped acquiring information, knowledge, and expertise.
I think that's what comes with a curious mind.
Right.
When you start to say why and how can I do it better. And when you stop asking those questions of yourself, you stop learning and you stop growing. But one of the things I found is that I learned when you come right out of school, with my father's influence, directed me to learn how to restore and rehabilitate a single tooth at the very, very highest levels that would give a solution that would last the longest amount of time, thereby making it probably the most valuable procedure you could do for a single tooth. As time went on, it didn't take more than a few years to start realizing that we needed to apply those principles to the mouth as a whole, not just a single tooth.
Okay.
And that's a different field. And it takes both a surgical knowledge base as well as a prosthetic knowledge base. That's what we don't have very much in dentistry, the combined skill sets of surgery and prosthodontics.
Now, you are the founder of something called the Pacific Implant Institute, Dr. Zokol.
Yes.
When did that come along, and is that a consequence of your curious mind and the acquiring of new competences?
Yes, and it started back in 1996, Sterling. What happened is that I started training dentists to be surgeons back east. I would fly back to Toronto, Montreal, Quebec City, and we would teach implant surgery to dentists who are interested in growing their knowledge base and expanding their skill sets.
Okay.
So what happened is that I realized that we didn't have anything on the West Coast, and we didn't have anything at the university level that would help a dentist become skilled in surgery and prosthetics without losing their practice and going back full-time into a graduate program, if they could get in there at all. So I started the Pacific Implant Institute in 1996, and I've been together now 18 years. We've been teaching dentists from all over the world to learn how to do implant surgery and do the prosthetics and rebuild mouths. And that's what my practice has been. So I have a full-time practice, but it's a referral practice, if you will. And it's for people who want the very, very highest level of surgical and prosthetic reconstruction, be it for a single tooth or for many teeth or for all their teeth. Let's say they don't have any teeth in the mouth.
Right.
How to give them implant-supported teeth, which would restore the same strength and integrity of biting and youthfulness that their natural teeth had before they lost their teeth.
What's the difference, though? Why would one want to go in the implant direction, Dr. Zokol, versus the denture, what my dad used to call false teeth?
Sure.
Because they're very popular, and they seem to be, from where I'm sitting at least, still probably more popular than implants, although that dynamic is shifting.
And it's shifting in a major way. Now, all around the world, I think we're spending right now, our human race is spending about $2 billion on implant-based treatment in dentistry. We expect that to jump to $6 within the next number of years.
So $2 billion a year already.
Already.
Wow.
This is not new.
Right.
There are so many dentists around the world doing implants. Unfortunately, many who have been trained on a marginal basis and don't understand the field as well. So we have a lot of cases, I think Dr. Birdie, who we'll talk about in a while, both he and I are realizing that we're having to retreat a lot of implant cases.
Right.
Just because it hasn't worked out too well. And somewhere down the road, we'll get into those concepts as it pertains to implants.
But I guess the rudimentary question here is the difference between a denture and an implant, and why should I prefer an implant over the old school denture approach?
Yeah. So let's talk about that for just a minute.
Sure.
Let's talk about what a denture is and how it differs from your natural teeth. And when we lose our teeth, it could be through disease or it could be through forced destruction of our teeth or a combination of both.
Okay.
And as soon as we lose our teeth, and people who have been in pain most of their life, who didn't like to go to a dentist, have more and more problems, it was easier for them to take their teeth out and have dentures placed than it was for them to go and try and rebuild everything.
Okay.
What they found is that the great majority of these people found that when they went into dentures, they didn't stop having problems. In fact, the bones started to dissolve under the dentures, and the dentures didn't fit after a while, so they'd have to have it relined, and they need a new set of dentures, more relines.
Right.
But there's another thing that happened as well. The tissue quality started to change, so that future dentures down the road became more uncomfortable and more difficult to wear, and you stopped being able to eat the foods that kept you healthy.
Now, has denture technology at all changed in recent times to make those old findings a little less apparent?
No.
Wow. Okay.
No, they have not changed. In spite of what anybody might say, fundamentally what happens is that now when you put your biting force on dentures, it transmits that force through your gum tissue into your bone structure.
Okay.
Teeth bypass the soft tissue. You'd bite on the teeth and it would go into the bone structure directly from the teeth. But as soon as you take the teeth away, now your biting force has to compress the gum tissue. And the body doesn't like to be hurt. So what we find is that people who are in dentures have about 10 50% and sometimes even less of the original biting force that they had when they had teeth.
Isn't that interesting? Are most people who come to you at the Pacific Implant Institute inquiring about implants, do most of those people, Dr. Ron, wear dentures, or are they just people with tooth problems that want to skip over the denture stuff and get to the new approach?
I think people who have had teeth most of their life don't ever want to go to dentures.
Okay.
But people who have been wearing dentures and have adapted to dentures find that it's okay to wear dentures. And they've learned to it. And many have come to the position that, well, maybe there's nothing else for me, therefore I better learn to adapt and tolerate this. Because if there's nothing else, then why cry over spilt milk if you can't do anything about it? So they've learned to adapt, and that's so we find people having found now problems with dentures. Once they've had dentures, once that bone melts away and they become more difficult to live with their dentures and more difficult,
Right.
now they want to change back, but they've lost a great deal of the bone structure of their jaws. Now we can still work with them,
Okay.
for sure. We can still work with them and give them implant-supported teeth back. Could be implant-supported teeth on teeth that are rebuilt like a person would have crowns, or it could be implants supporting teeth like a denture. But at least when you bite together, as soon as you have implants put in and a denture put on top or other teeth, you have an immediate 300% increase in your biting force potential.
Interesting.
And it grows from there.
Right.
It gets better and better and better as time goes on. So the value of going from dentures to implant-supported teeth is absolutely massive. Not only does it give you the better potential to have increased nutrition and increased health, but also rejuvenates you. It sometimes gives you the opportunity to look younger, and I can show photographs where people who have put their implant-supported teeth in immediately after wearing dentures, and you take photographs of them, some of these people look 10 to 20 years younger.
To say nothing of how they feel, right? Because, there's a whole thing about confidence that comes along. If you have teeth issues, you're a less than 100% confident human being because you're constantly aware of, well, I can't really smile like I used to be able to because I'm kind of embarrassed about it, but, I still want to show pleasure, so I wink a lot or whatever. People do that. They sort of hedge themselves. They don't display themselves as openly and as confidently as they know they can when everything's okay in their mouths.
You're absolutely right. What we find is that people who have upper teeth, for example, dentures that move, and I'm talking about ones, not the ones that fit really well and you got a large formed arch and you can smile and do everything without it falling out, but when you start to lose the confidence in your ability of those upper teeth to stay in place, now you start to question whether or not you're presentable.
Sure.
Can you go to dinner and have a sip on a spoonful of soup without your teeth falling in your soup?
Mm-hmm.
When you smile somebody and the muscles in your face push against your teeth, will they drop out? People stop smiling.
Yes.
And when people aren't smiling, other people think they don't like them. So when you smile, you're inviting. But when you're frowning or closed up, you're not. So people who have the confidence in their teeth will actually do better socially and in business as well.
And the human value to that loss of social awkwardness, that loss of feeling that you have to restrain yourselves when you're around other people, and you're able to just get in there with your shoulders back and march along, the value to that to any person is enormous.
It is. And everybody who's listening out here right now will see if that applies to them. And the truth of the matter is, I see hundreds of people like this who have gone through the process and seen the transformation that these people enjoy. And I have some stories that are absolutely outstanding in terms of how it's changed people's lives.
Well, perhaps we'll get you to tell a couple of those stories. We need to take a break here in just a second, but I'm looking forward to hearing about some of those stories. But just before we take the break, on the general subject area of implants and versus dentures, because you're talking about people who wear dentures, and this is boomer life, and I'm sort of assuming that we're talking about boomers, but we're not, are we? We're talking about people of all ages who have teeth issues, and some are children.
Yes, and some people in areas of even our country have their teeth out at 16 years of age.
Yes.
With the belief that that's a natural occurrence.
Mm-hmm. And imagine the value to a young person, still a developing human being, to all of a sudden to go from no teeth or a profound loss of teeth to being able to be just one of the regular kids who can smile like all the regular kids.
Mm-hmm.
An enormous change.
Oh, very, very much so. And these are people who by age of 40, 45 are now denture cripples and can no have the bone structure to keep dentures in their mouth.
Oh, so dentures are in a strange way terminal in terms of the impact they have on the bone structure in your mouth.
Yes, you put pressure on those tissues and the bone structure and it melts away over time.
It's so good to have you back at 650 Sea Isle, as you choose to call us. We just call it AM 650 these days, but I like your version of it much better. Dr. Ron Zokol, I hesitate to call him a dentist. He's so much more than that. You can learn a lot more about Dr. Ron at zokol.com, ZZOKOL.com. And yes, that is a familiar name, isn't it? Famous British Columbia golfer Richard Zokol is our guest's brother. Older
Correct.
Or younger?
Younger.
Little brother, probably still just take a round at golf anytime too, eh?
Like anytime.
My little brother does the same to me. It's kind of embarrassing. This is Boomer Life on AM 650. Lots more ahead. Stay with us.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life
On AM 650.